Hello, I am Marwan Abourass. Today, I'm going to explain what is the 4R operational diagnosis protocol and why I highly recommend that you, the young dental graduates, in general, practitioners, learn how to use it in the diagnosis of endodontic, prosthodontics, and periodontic problems. It's a very powerful diagnostic method. It's comprehensive and multidisciplinary. The powers of the protocol and the benefits of the protocol are built in systematic approach to protocols and clinical guidelines. Again, evidence-based guidelines, which are essential in the diagnosis and treatment of modern healthcare problems. The protocol helps you develop a permanent, organized, and systematic approach to the diagnosis and treatment planning. Thus, you will be building a very positive philosophy from the beginning of your career in dentistry, especially how to deal with patients and how to build a positive relationship with your patients, again, using the protocol. You will be diagnosed more efficiently because you will have a structured approach, 1, 2, 3, 4. Thus, leading to more accurate diagnosis and less diagnostic errors and better quality care. The most important benefit, in my experience about the 4ROD, that it will not only, give you patient questionnaire, the 10 ADI, these are so many things you will learn in the protocol, but you will have a philosophy. You will have your own diagnostic philosophy that you apply in your career, and that's very important. So it's been a very long journey developing the protocol, almost 50 years, from Pennsylvania to California, to Saudi Arabia, to overseas, etc., etc. It's been almost half a century of endodontic diagnosis and general dentistry implementation of these philosophies. I'm really happy to share my experience with you. God willing, this protocol will be the first exciting content that will be featured in the Abourass Endodontic Academy soon, God willing. So now, let me go in details, describe the protocol. The protocol has 4 diagnostic data collection and finding phases. It's all start with the letter R: reports, radiographs, response testing, and restorative and tooth structure assessment. The protocol can be used when one tooth, single tooth, a quadrant of dentistry, or a whole mouth, comprehensive dentistry. So now let me go through the 4 R's. R1 is the first step. In this phase, you will be building your relationship with a patient. You'll be starting with the social history. Who are you? What's your name? Where you come from? What do you do? You don't ask them about their pain. You just ask about themselves and establish that relationship. And then you go into details. You will learn more about your patients. And then you will be in R1 carry on an oral exam, a very short one, an initial one, just to classify your patient. Is it an emergency patient? Is it limited treatment patient? Is it comprehensive care patient, etc.? Very simple, quick examination, and decide what kind of x-rays you're going to need and what kind of tests you need to perform. R1 has actually 8 distinct activities that will be described in detail in the PowerPoint presentations. Then R2. R2 is very important. It advocates the routine use of PA and bite-wing radiographs. They are essential because they are very efficient, they're very accurate, and they have minimal risk in terms of radiation. I use the CBCT for surgery or complex diagnostics. I use the OPG for screening, initial screening, what this patient is all about. But the workhorse is the PA and the bite wing. R2 has a flow chart. It's called the 10 ADI, Areas of Diagnostic Interest. It has also the 10 PCDIF, the 10 pulp chamber diagnostic imaging factors. These are very powerful diagnostic tools. Teach you, guide you how to interpret X-rays, how to diagnose. These are evidence-based landmarks designed for systematic interpretation of pulp, periapical, periodontal health status, the endodontium and the periodontium. Then we have R3. R3 is response testing. It focuses on extreme cold testing for eliciting a pulp response. Cold pulp testing is considered a standard of care. I do not use electric pulp test. I do not use the heat test. I do not use many of the traditional tests. I use diagnostic pulp biology and cold test. It's only one part because I have 4 R's. I have other issues to worry about. R3 also include performing a standard 6 indices of a plaque, gingiva, pocket depth, attachment level, mobility, and fistula tracking. All of these are gingival and periodontal health status indices, which we use. And then we go to R4. R4 is the restorative and tooth structure findings. It includes comprehensive examination of the tooth surfaces, cracks, fractures, attrition, erosion, anomalies, tooth alignment, other pathologies. Very comprehensive appraisal of the tooth structure, whether it's intact or restored. The R4 evaluation also, very important, use the Federation Dentaire International biological and aesthetic criteria, which is very recent, 2023, to evaluate the crown, to evaluate the restorations. R4 is very important stage. It's physical, it's operational, it's exploratory. It's the end of the protocol. And once R4 is completed, then you should be integrating and comparing R1, R2, R3, and R4. And then produce a diagnostic problem list, which is the prime problem, endo, perio, resto. Once you have that, then you temporize and you sit down with the patient, one-on-one, explain everything. This feedback paved the way for more formal case presentation that you will present to the patient. The 4R operational diagnosis protocol is the best practice in my hands, at least. We have trained generations of endodontists, advanced education in general dentistry, different boards, international, on the system. Thank you for listening.